Welcome to Trinity Heart Center. We're here today to introduce you to Dr. Carstens, one of our telecardiologists.
Bringing somebody into the clinic like we're doing here gives us that ability to have a nurse or medical assistant room the patient, verify their medications, check their vital signs, get a pulse of their blood pressure, and then also get an EKG, having the virtual stethoscope where we can listen to patient's heart and lungs, having the camera that we can move around, having the medical assistant or nurse that can push on the patient's leg to see if it vents in and tell us if they have some edema or swelling. All of those things are things we couldn't do when in the patient's home. So there's a lot of benefits to doing it this way, I think, and it's been a really much better experience for me, and I think for the patients as well.
Everything from the way that we room a patient, where you come on site and you're cared for by a nurse. Also, just the shortage of cardiologists. Gosh, those are staggering numbers. How short we are cardiologists across the country.
We can provide a lot of services right there in Fort Dodge. But some services, some advanced procedures mostly, require a referral out. We're really seeing the full spectrum of cardiology, at least the full spectrum of cardiology that we would normally see in a regular cardiology practice. We're seeing patients with chest pain. We're seeing patients with atrial fibrillation or other arrhythmias. We're seeing patients with heart failure. We're seeing patients with high blood pressure, high cholesterol. There's really nothing that we've seen today. Patients with severe aortic stenosis that we're referring for advanced procedures like TAVR. We see the atrial fibrillation patients that we're sending them for ablations and Watchman and these other kind of procedures, left atrial appendage occlusion. But we're also seeing a lot of patients that we can take care of right here in the community. We're saving the patient time. We're saving the patient travel. We're allowing them to get the care as close to home as possible.
Yes, that really excites me to be able to provide the level of care we're providing, whether you're through the telemedicine program or you're right here in person. It sounds like we're able to do all the things that we need to do with you present and helping the patient.
We're all on the same shared health record across UnityPoint Health. So if I send you to any of those places, they'll have your record, they'll have your medical record, they'll have all the tests and the studies that we did. And then when you come back for your follow-on care, I'll have all the tests and studies that they did. We're all part of the same larger team,
yes.
UnityPoint, and so that's, I think, also some advantage. If it wasn't for the fact that I was on a screen, it wouldn't be any different to you than almost any other place that you'd ever visited.
You have a wonderful cardiology team. Dr. Carstens, thank you for spending the time with us today just to get to know you a little bit better and how telecardiology works in our clinic. We're really glad to be able to showcase some of the great care that we give right here in Fort Dodge.